Me am say di hu say some movement no me kwakodi duane a omuodu no.
I have gotten to know that eating late won't be beneficial to my health. It doesn't help.
8, 9 and be a me pon ntem kra. E bi kro to me pon be 10, 11. Na me ba 8 no ma pon a na makwakodware no me didi a. Na sa tam no duane fufu no wa wasi wo be sa moment na me mpe.
Unlike 60-year-old Matthew Atta, Kadr Isaka hasn't been successful controlling his nightly cravings, a lifestyle which seemed to have upped his blood pressure.
I get home around 10 p.m, so I end up eating late. Some time ago, I wasn't feeling well, so I went to the hospital where I was told I have blood pressure. I have been advised to stop eating late, but I can't.
So because I'm saying pressure, so me just I did
Commercial drivers, like any other driver, are exposed equally to risk factors associated with the driving occupation. These factors can lead to poor health conditions that have a bearing on their performance on the road. In Ghana, research has found 23% and 53% hypertension and pre-hypertension prevalence among taxi drivers. Again, other reports have found about 39% and 90% prevalence of unrecognized hypertension and obesity. High blood pressure can cause heart attack, stroke, heart failure, blurred vision, and temporary loss of vision. Dr. Kwesi Ahmed is an eye surgeon at the Kofanochi Teaching Hospital.
For hypertension, you can have someone who he says, "Oh, my BP is high. It's always high." You think you are fine, but what is happening is that there's gradual damage to the cells and the vessels that are in the eye. The vessels that carry blood become stiff. Okay, so eventually it can progress, and then and it's worse in younger people. You know, where they come with hypertensive retinopathy, stage 4 hypertensive retinopathy, and then they can't see, and it is irreversible. Sometimes to your care, you have a sudden rise in your BP, especially now that most people are stressed, most people are not eating well. You know, your BP suddenly goes up, and then all of a sudden the vessels in your eye just rupture. Okay, and when they rupture, you bleed in the eye, vein occlusion, and then you suddenly lose your vision.
These conditions have largely been attributed to poor lifestyle choices. Benjamin Mensah of Stay Alive Health Campaign has been observing these poor lifestyles among drivers.
Drivers do not pay attention to their health. Drivers do not even have time to rest. Drivers don't have time to eat. They may say that they eat good food, but at what time do you eat the good food?
In collaboration with the National Road Safety Commission, he has been screening drivers in Ghana's second largest city of Kumasi and another city, Obuasi.
In all, we screen about 680 drivers or people, 495 being commercial drivers. Yeah, in the case of hypertension, we realized that 2 out of 5 drivers were hypertensive. And then again, 1 out of 10 drivers were pre-hypertensive.
What can drivers involved in road crashes be suffering from? A study by the Kwame Nkrumah University of Science and Technology might provide some answers. The findings, published in the Sage journal Clinical Pathology, has found cardiovascular diseases to be the major conditions among drivers who died through road crashes. The study, which examined 127 driver deaths from 2009 to 2014, found that 44.08% of the cases were due to cardiovascular diseases. Dr. Jose Puku Sampini is lead scientist.
When the drivers were identified, the autopsies that were conducted were such that we took samples, certain samples, like the brain, maybe the eye, samples from the eye, the heart, the kidney, the liver, and so many other organs that were vital as far as the functions of the body is concerned. So we did that. And so when that was done, what happened was that realized that a lot of them, in fact, a lot of them had what we call systemic diseases, such as cardiovascular diseases, hypertension, cerebral. In fact, for instance, if somebody also is cardiovascular, you are looking at dilated cardiomyopathy. You are looking at so many mitral valve stenosis. You are looking at congestive heart diseases. You are looking at myocardial infarction, especially. The person is hypertensive. Probably he's on his drug. He's probably on drugs, but he's not taking it. Or some of them are also not on drugs at all. They don't even know that they are hypertensive, yet driving. Do you understand? So when they get episode like stroke while driving, the person cannot be in a position to remove the leg from the pedal, because depending on where the lesion is. If the lesion is on the right side, so the left side, these are the right side of the limb, which actually controls speeding, is going to step on the accelerator whilst he is not able to remove it from there.
What can be done then to assuage the situation? Dr. Sampine recommends a second look at license issuance.
Those who are going to issue license to prospective drivers, not only would they just go and ask you to, if you are able to read whatever they try to let us read. Sometimes you have to go deeper. There are people who have glaucoma. There are people who cannot see very well. There are people whose necks, probably they have some form of neck problems where they cannot turn the neck the way it's supposed to be turned for them to be looking around whilst driving. Do you understand? And those who are hypertensive, I'm not saying that if you're hypertensive you cannot drive. If you are hypertensive, make sure that you take the drug as instructed.
Dr. Sampine and Mr. Benjamin believe the hospital must be moved to the drivers.
You can set up mini clinics in the various lorry stations and then the various rest stops, so that every car that moves any long distance, when they get to rest stops, the driver subjects himself to these people. I'm talking about the nurses, and then they check their BPs for them. When they are leaving the station, their BPs are checked, and then records are kept, so that if there's anything that we are seeing that somebody is hypertensive or somebody is likely to be hypertensive, the person is alerted and then checked, probably given medication. By so doing, we are looking for employment for those people, the nurses who are probably staying at home doing virtually nothing.
We must move the clinic to the drivers. This year, this is what we are trying to do. We decided that we'll go to 5 regions to start the campaign. We started in the Ashanti region. We are moving to Eastern region this June to continue with the screening. We will screen them on eye, dental, ENT, hypertension, what you call BP. We do normal body examination, blood sugar for them. We don't take money from the drivers. We don't take money from the drivers. We do it for free for the drivers.
In an era where diseases like hypertension and diabetes keep on rising, it's become crucial for an initiative like Benjamin's be encouraged so that precious lives are always protected. Reporting for Joy News, Kwesi Deborah.